At the top, you have SIBO suspected. So this is going to be if you have symptoms that are making you think you have SIBO. And then you do the breath test. I'm saying this nonchalantly, but I cannot believe how many people don't do the breath test. And we can't diagnose the condition without the breath test. And the reason why is because the symptoms of SIBO are the same symptoms of like around 40 other diseases. And so how somebody has bloating, they could have like 40 other diseases. How can you say they have SIBO? You have to do the test and figure it out. So I'm going to start with just a broad overview, and then we'll go through antibiotics, herbal antibiotics, and elemental diet. So those are our three main antibacterial treatments. And I just want to make an important point, that is that they're all about equal in effectiveness. So elemental diet is a powder or a liquid of pre-digested nutrients that are drunk in place of all meals. And the protocol that we're doing is for 2 weeks, maybe 3 weeks. And so this is the way you do it for SIBO. Elemental diet drinks can be used in other ways, but we would do it to replace all meals for 2 to 3 weeks. The protein is amino acids, fats are oils, and the carbohydrates are glucose usually or maltodextrin. And then there's vitamins, minerals, and some salt for electrolytes. And the concept behind it is to starve the bacteria, but still feed the patient, because the idea is, since it's mostly pre-digested, it could absorb into the body very quickly and very high up in the small intestine, and quickly enough also that it doesn't barely get a chance to feed the bacteria. They can't grab onto it and eat it. And so they starve. So the idea is it's killing by a different method than herbal antibiotics and antibiotics. Okay, so some basic points here. Prokinetics don't clear SIBO. They're not a treatment for SIBO. So, and also don't expect symptom relief in most, unless you're using them at a little bit of a higher dose, or also in the day, like around mealtime, because we can use them that way to help with symptoms. But if we're just using a low dose at night, we're not trying to treat symptoms, and we're not trying to clear the SIBO. So the takeaway from this is, like, for the patients, don't stop the prokinetic because you can't feel it working, because you're really not supposed to feel it unless it's being used in the day or at higher doses for symptomatic relief.